Could psychedelics help veterans struggling with mental health issues like PTSD and depression?
Now in the Bronx, there's a clinical study on psychedelics that we've actually been a part of, and it's working. We're seeing tremendous change. Bobby Kennedy, who's now the new HHS Secretary, Health and Human Services Secretary, he and I sat in my office 2 weeks ago and talked about this very issue. And how do we get it incorporated in?
I'm Dr. Sharma, physician, board-certified psychiatrist, and Air Force veteran. Doug Collins, the Secretary of the VA, sat down with Shawn Ryan on his show recently and talked about psychedelics. And this is a very important topic when it comes to veterans' mental health. There is a treatment here that is untapped by most veterans, mainly because it's not widely available. Let's dive into why that is and why psychedelics could change the game. One of the main reasons why it's not widely available is something called institutional rigidity. Basically, there are organizations like the federal government and others who are inherently resistant to change, and it stems from the demonization of these forms of treatment in the past. This started in the 60s and 70s, with psychedelics being looked at as very harshly by the government, and this has persisted over time. We can speculate on why this happened, maybe the influence on people when it came to resistance to the Vietnam War, or resistance to violence in general, and how countercultural it was. Feel free to speculate in the comments. And don't get me wrong, there are dangers in this form of treatment, which we'll get into, but I'm just giving the background of where this resistance comes from.
And this is what I'm facing almost all the time is, well, you can do that, but there's a risk. Shawn, getting up out of bed in the morning and going to the bathroom and taking a shower is a risk. I'm going to fall and bust my head and die. That's a risk. Getting up and walking and getting a car is a risk. I want us to help the people who need help.
So what Secretary Collins is talking about here is something we look at in medicine and psychiatry overall, and that is the risk versus risk discussion. There is a risk of using psychedelics as a form of treatment. However, there is also the risk of untreated PTSD or depression becoming worse and causing harm to the veteran. The question is, which risk is higher? And the answer is, it depends. And yeah, before you throw tomatoes at me, I know that's not a satisfying answer, but it's the truth. This will absolutely depend on each case. Each veteran will have to be looked at by their own treatment team to see if psychedelics are an appropriate option for them. And that same risk versus risk assessment has to be done on each case. For instance, if I have a patient with strong psychotic features, so they're prone to having hallucinations or severe delusions, I would really hesitate before recommending this form of treatment because of the risk of having a bad trip and worsening the symptoms. On the other hand, if I have a veteran with PTSD without prominent psychotic features and they've been on so many different types of medications in the past with no benefits or a lot of side effects, then this might be a good option for them.
Is there ways under right to try that we can expand some of those programs right now into psychedelics, into others, treatments, from range from hyperbaric to everything else that says, is this working? We know from case like what you just talked about that it is working. We know from experience that in some people this is a dead-on treatment for what they need.
That's exactly right. There is very promising research, and I'd go even further than case studies because we now have peer-reviewed studies with decent volumes of cases. There are entire bodies of research showing how effective psychedelics can be in mental illness, especially in veterans. And remember, there are different types of psychedelics. Some examples include MDMA and Psilocybin. Studies from 2022 and 2023 looked at MDMA-assisted therapy, and it was effective, safe, and well tolerated in clinical trials for PTSD. And these studies were based on prior research from the years before. Psilocybin, similarly, has been studied for many years, and same thing, safe, effective, well tolerated in PTSD, specifically veterans with severe treatment-resistant PTSD.
And a friend of mine recommended mushrooms, and I was able to use those and relieve my depression so quickly that I just thought, this is incredible, and there's no reason why these should be illegal.
After military veteran Dan Horner's experience with mushrooms, he wanted to help others, so he created the Science of Psychedelics Conference, a chance to educate, inform, and enlighten the public on natural medicines.
It's a revolution. It's going to change everything, and it's coming pretty quickly. quicker than I think most people realize, and especially people in the mental health field realize.
There have also been studies involving ayahuasca and other psychedelics as well. And look, I'm giving you guys a broad overview. There's a lot more research out there, but I don't want to bore you with all the details and citations. The main takeaway is that there are psychedelics that can be potentially administered once and give lasting relief to the veteran for months at a time. That also brings the potential of veterans not needing to be on daily medications for the rest of their lives. Because let's face it, psychotropic medications have their own drawbacks when it comes to side effects. And look, this is not some panacea. It's not a cure-all for everything. It's not going to work for everybody. Everybody's body chemistry is different. Genetics plays a role. This isn't going to fix everyone, but it has the potential of healing a lot of people out there who are struggling, and we really can't lose this opportunity. Now, you might be wondering, yeah, doc, so you're telling me about these psychedelics, but how does this actually work? Well, let me give you an idea of how some of these studies are structured and how the treatment is structured, and why it's important to do this in a controlled environment with a licensed professional and not just get some random shrooms from Billy Bob down the road. Let me set the stage. A patient enters a study. Let's say this one is on psilocybin, mushrooms. There's a room where they meet with a therapist who's going to help guide them through the process. And remember, at that point, they've already met with a psychiatrist beforehand. They had vitals done, blood work. They were cleared from a medical standpoint to try the treatment. All that jazz has been done. They've also established what their goal is with this type of therapy. They want to decrease or possibly eliminate their symptoms of PTSD. They have a lot of different symptoms they want to get rid of, like depression, guilt, lack of joy, and so forth. Now, in the actual session, the patient will lie down on a couch. The lighting will be dim. The therapist will be seated in front of them, ready to guide the patient through the experience. After receiving the dose of the psilocybin, the patient will put on an eye mask. There might be relaxing music playing in the background, and the journey will begin. It'll involve exploring where the symptoms are coming from, how and why they started, how they've derailed the person's life, everything that matters. And again, the therapist will be right there doing the guidance and making sure the patient doesn't feel unsafe or like they're spinning out of control. This is called psychedelic-assisted therapy. You see how it says assisted therapy, so it's not just taking psychedelics and just hanging out. Now, you see also how they make sure the patient isn't exposed to too much stimuli in their environment. Sometimes they can even use noise-canceling headphones to help with any other sounds in the environment, or if the patient really needs to have no stimuli at all. A lot of times when people take psychedelics on their own, they don't know the source, what the exact dose is. They do it at home or maybe at someone else's house, and there are a lot of wrenches that can be thrown into the process. Imagine you take psilocybin for the first time at home. You take it kind of lightly, like it's not a big deal. Someone rings your doorbell, you go to answer it, and you see a man with the head of an elephant. It's going to freak you out, okay? And it might result in you having what they call a bad trip. Also, you have to have real goals before you take the psychedelic, and someone along the ride to help you achieve those goals, help you dissect whatever you see during the experience. This is why it's so important that it has to be done in a controlled environment, and this is why it needs to be more widely available in a regulated and safe way. Again, as a form of treatment for mental health issues. In the interview, Shawn Ryan talks about nonprofits who are doing this type of work with veterans. This includes organizations like Vets and others who help veterans get access to psychedelic-assisted therapy. And there is the possibility, and I do hope they can do this, where they can have a voucher program where the VA can allow veterans to get treatment from these nonprofits. But like they talk about, there are a lot of hurdles they need to cross for any of this to happen. And of course, ideally, the VA should be able to administer these treatments themselves. That would make it much more easily available and not have so many hurdles in the process for veterans to have to jump through. In the end, we have to break the rigidity and inflexibility that people have when it comes to psychedelics. And when I say people, I mean lawmakers and authorities. We can't continue to allow these alternative treatments to be sidelined. especially when it comes to folks who are actively suffering and need the help. Let me know your thoughts on this topic in the comments. As always, I want to hear from you guys. Would you be interested in psychedelic-assisted therapy? Do you have concerns about it? Are you excited about it? Tell me what's on your mind. If you enjoyed this video, you might like the episode I did where I guide you through a short mindfulness exercise to reduce your anxiety. Click here to check it out. Also, click over here to subscribe if you haven't already done so. As always, thanks for watching. Dr. Sharma signing off. See you next time.